It's my pleasure to introduce Dr. Vijay Limaye today. He comes to us from the National Research Defense Council, where he's a climate change and health science fellow. Dr. Limaye got his undergraduate degree from Berkeley and then his PhD in environmental epidemiology from the University of Wisconsin. Prior to being at the National Resource Defense Council, he was also at the EPA for 3 years in regional offices in San Francisco and Chicago. Basically working on the kind of topics he will talk to us about today, which is climate change and its effects through extreme weather events on our health. Costly risks, common solutions. Pleasure to hear you.
Thank you. Thank you for the invitation. Really happy to be here and share some of our work happening at the Natural Resources Defense Council, NRDC. How many of you have heard of us, just so I know? Okay, I have some explaining to do. Hopefully we're all set here. And so today's talk is going to be about climate change and the connections to human health. I'm really grateful to see such a big crowd here because this is a topic that's, of course, near and dear to my heart, but it's one that is often hidden from our public understanding of what climate change actually means in terms of risk. Just to take like a 30,000-foot view of this topic, I saw a startling statistic the other day that in 2017, of the more than 40,000 scientific articles published on climate change, just about 4% even mentioned human health as a risk related to climate. And about 1% of those 40,000 articles were specifically focused on the health impacts. And so this is really a topic in which we're doing a lot of work to catch up with the rest of the science on climate. And I'm eager to share this work, but also happy to chat after about other links that we're exploring. So just a bit about the Natural Resources Defense Council. We are one of the biggest and oldest environmental advocacy groups in the country. We'll turn 50 next year. And we are a team of scientists like me, but also lawyers and policy advocates working to protect the environment and human health. In recent years, that means resisting and pushing back against regulatory rollbacks happening in this country, but we also do quite a bit of work internationally in support of international climate negotiations and other environmental protections. So I'm based in our headquarters in our New York office. We're actually closer to 700 staffers at the moment. We have a number of offices around this country. I also do quite a bit of work with our small team based in India, and we work as well in Canada, Latin America, and China. If you're interested in finding more about our work in nature, in human health protections, in climate and clean energy, happy to connect you with folks. So I work with Kim Knowlton, who's a senior scientist at NRDC, and it's kind of the two of us that lead our climate change and health work. Kim's also an associate professor at Columbia, and we work pretty closely with students from across the country, really, to advance work on climate change and health. So if any of you are students interested in internship opportunities or other ways to connect this work on environmental advocacy and strategic application of science for public policy, I invite you to chat with me after and check out our website, which I'll point to at the end. In terms of the overarching sort of corners of our work, this is what we are up to at NRDC to tell the human story of climate change. I'm an epidemiologist, a health scientist, so I focus largely on our research side, but I also support our advocacy on climate change and connecting the dots in terms of human health impacts in the United States. We're also increasingly working on the topic of climate change adaptation and preparing communities for the harm that we know is coming from climate impacts. We also have a pretty big communication shop, which for me as a scientist is really exciting because it allows us to tell the story of climate change and the human impacts in new ways. My twin brother's a geologist, so I am throwing him a bone right now by talking a little bit in geologic time and trying to sort of offer us some context in the climate crisis. I think oftentimes we are faced with news about a pretty worrying future, and we see all the statistics out there, and it's harder to really grasp the overall picture of where we are in terms of uncharted territory, right? So this graph really gives you a sense of centuries, right? Millennia of environmental monitoring available through, sort of direct temperature measurements, but also measurements in glacial records and other natural records of our Earth's climate. And you can see here, this is why this is called the hockey stick graph, right? This is showing us that we are seeing accelerating climate risks. We're seeing temperature trends really off the map in terms of the human experience. That's important because our society has evolved within a relatively, documented envelope of environmental conditions. And so we're facing unprecedented environmental change at a speed that we've never seen before. And while we face profound risks, we also have choices. That right side of this graph shows a number of colored lines, which represent different temperature trajectories here, right? And so we really do have choices right here, right now, that will have profound impacts on environmental conditions in this country, certainly, but around the planet for decades, if not centuries to come. So I'm going to try to offer a mix of sort of sobering science today, but also hopefully an optimistic tone about where we might head next. So in terms of the overall topic of climate change and human health, one thing I want to leave this audience with is the appreciation for really the complexity of impacts that we're talking about. So this is a figure from my PhD advisor, Jonathan Patz. It was published more than 20 years ago, but it really rings true in terms of spelling out in human health terms what the environmental changes linked to climate change mean for our well-being, right? So we're talking about key environmental drivers, right? Temperature change, sea level rise, changes in the hydrologic cycle at both ends, both drought and stronger storms. And those environmental changes are linked through pretty solid science to a range of really profound impacts on the systems in which humans have built society, right? And so it's not just heat waves, right? We hear about extreme heat as one of the most profound and sort of easier quantifiable impacts from climate change, but we're really talking about a whole host of human health problems that are linked to temperature change, sea level rise, et cetera. I'm going to focus on a number of the impacts spelled out in this figure, but I do want to sort of leave you with the appreciation for the mounting science. I mentioned those small figures at the top of the talk. But there's increasingly a lot of folks working in this interdisciplinary space of connecting climate change to environmental epidemiology and the health sciences and engaging the medical community in telling the story of climate change. So I'm going to talk today about new work that we've really been pushing forward at NRDC on the economic ramifications of climate change for human health. And this is a quote from the 4th National Climate Assessment. Have any of you heard of that federal report? Okay, so our leaders in Washington, some of them, attempted to bury this finding by releasing it the day after Thanksgiving last year. And they didn't succeed, right? This headline about costs bearing down on American society right now actually made front page news in the New York Times in terms of spelling out climate risk as a huge hit to GDP in this country, right? And one of the key points from this 4th National Climate Assessment, which is really the federal government's compendium of the available science, which is huge on climate change, is that climate change is not some future intangible risk, right? We've already warmed about 1 degree centigrade from the pre-industrial era, and we're on track for even more warming at an accelerated pace. So this isn't a problem that we can sort of continue to kick the can down the road in terms of public policy. These are costs that are impacting American families right now. The 4th National Climate Assessment spelled out these costs in terms of hundreds of billions of dollars in economic risks. And that's because we're talking about systematic stresses across the country. One thing about a quote like this, though, is that human health has been largely sidelined from our understanding of economic risks associated with climate change. So that grim list of environmental events that I spelled out on the previous figure is linked to a whole lot of costly medical care. We have one of the costliest medical systems in the world right now. And so it's really upon us to connect the dots here, right, between human health and economic damages to spell the case out for policymakers and sort of add evidence to what is already a huge evidence base of our need to act and act fast. In terms of 2019, I want to give you a sense of what the federal government is doing to sort of track disasters and climate-sensitive impacts. So this is a figure that's updated monthly by NOAA, the National Oceanic and Atmospheric Administration. That's where the Weather Service is housed. And NOAA compiles basically an ongoing compendium of what are called billion-dollar disasters. These are climate-linked events that have impacts on property and infrastructure damage across the country. I'll note here that a number of the impacts here, for example, tornadoes, are not climate change sensitive exposures, but a number of them are, right? Flooding, for example, in the Midwest. I also want to note that this figure is through October 9th. What's been happening across this country, or at least on the west coast of this country, since October 9th? Huge wildfires, right? So California has seen the costliest and deadliest wildfire seasons in its history in recent years, and certainly we've seen dramatic examples of those fires both in the northern and southern sections of the state. Any of you following the international news out of Australia will have seen huge fires there as well, right? And an attempt to sort of silence the climate link. Only 3% of US reporting on the California wildfires by major news organizations linked fire risk to climate change, right? So we have a huge challenge in terms of telling the story and what's called ending climate silence. We don't want to end science. I'm a scientist. We know that climate change is linked to an increasing frequency of wildfire as well as an increase in the area of land burned by these fires and the duration of wildfire season. And so one challenge that's sort of upon us as scientists is to make sure that that link is made in the public sphere so that people understand that the very real suffering happening all around them is related to the fundamental drivers of environmental change and our climate crisis. So in terms of the long view of those billion-dollar disasters, this is sort of what we've seen since 1980 in this country. And you can see sort of each color on this bar graph is tied to a different sort of disaster impact across the country. And what we're talking about really is tremendously costly events, right? We are paying with our tax dollars, we are paying in terms of human health to deal with environmental disasters. Part of the story here is climate. Part of the story is where people are living, right? In the case of wildfires, we increasingly have humans living at that sort of urban-suburban wildland interface in which risk from wildfires is exacerbated. But if you take home anything from a chart like this, I just want to impress upon you that when NOAA is compiling that billion-dollar disaster list, it is not including health damages in the ultimate impacts, right? So if you think about huge events that we've seen, Hurricane Sandy 7 years ago, right? Hundreds of deaths attributed to that storm. Those damages are not counted, right? Because of a number of reasons, right? The health science takes some time in terms of underlying surveillance and connecting the dots between each of these exposures. But really this hasn't been prioritized at the federal level in terms of a coordinated effort with other federal agencies like the Environmental Protection Agency and the Centers for Disease Control and Prevention in terms of connecting the dots, right? So that's why we've undertaken new work to really shed light on the health component. So when we talk about climate damages and hundreds of billions of dollars, we're talking about things that are insured or repaired, right? But there are irreversible damage incidents happening across the country, right? If you are suffering a health problem that cannot be cured from a climate-related event, that's damage that's not incorporated into public understanding. As I mentioned, sort of the data linkages to do this are currently lacking. And so we've taken it upon ourselves to sort of start to tell the story here by using case studies to sort of shed light on the order of the problem, the magnitude of the problem. Colleagues of mine at NRDC published really a first of its kind synthesis study in 2011 on this topic. Since then, we've seen the warmest years on record globally, including the hottest month ever recorded, which was July 2019. So we've seen even more reason to expand this science and deepen it. So I'm going to spell out some of this work and then sort of connect it to the bigger picture through the rest of this talk. And feel free to jump in if any of the science terms are creating confusion. I mentioned this case study approach. And what we did is basically look at a single year, 2012, across the country at the range of climate-sensitive impacts that hit different localities and states. We used the available evidence that was, in all cases, public, to sort of stitch together the overall economic picture in terms of health impacts. And so we used what we're calling a combined valuation method to get at both the deaths triggered by these climate-sensitive exposures as well as the cost of illness, right? So expensive trips to the emergency room or hospital admissions. And so it was our attempt here to use these case studies as sort of symbols of what we might face in the future if we let this climate problem go unchecked. 2012 was just 7 years ago, but just to sort of refresh our memories, that was actually the hottest year ever recorded in the United States. The climate statistics from that year are pretty striking. More than 350 all-time high maximum temperature records, wildfires that burned more than 9 million acres out west, more than 2/3 of the United States in extreme drought conditions at one point or another, and 19 named tropical storms. On the heat side, specifically, there were at least 99 million Americans experiencing 10 or more days of temperatures that reached or exceeded 100 degrees. Right, so this is a year that really spells out the risks related to climate in very concrete terms. So here are the case studies. We looked across the country in terms of public health monitoring happening oftentimes at the state and local level to understand the range of climate-sensitive exposures that hit the US in just a single year. As I mentioned earlier, extreme heat, which we looked at in my home state of Wisconsin, is kind of the first impact that comes to mind. But one aim of this research is really to tell the story of the broader impacts of climate change on human health, right? So we're talking about different types of risks. We're talking about respiratory health risks, so things like ozone air pollution in Nevada. Summer ozone pollution is worsened in hotter conditions. We're talking about wildfire smoke in Colorado and Washington, which is deadly and can travel far downwind of the actual fires. NRDC has actually done work demonstrating that wildfire smoke can impact areas about 50 times larger than the area actually burned by the fires themselves. And some of that pollution from the smoke is the same pollution that we regulate through the Clean Air Act, right? Some of you may have seen a New York Times story, I think just last week, demonstrating a 25% increase in fine particle pollution across the country. Wildfires are part of that story, right? So we know that that type of air pollution is extraordinarily damaging to human health, and it's coming in part from wildfires. Another respiratory health risk, I'm an air pollution scientist, I really focus in this area, is allergenic pollen. Any of you who suffer seasonal allergies probably have experienced the lengthening of the pollen season in certain parts of the country. And so we looked at one state, North Carolina, for allergenic pollen impacts on asthma exacerbations, for example. I mentioned Hurricane Sandy. We looked at the impacts of that storm in New York and New Jersey, acknowledging that there were impacts beyond those two states. And the other sort of key category is infectious disease. So climate change is expected to worsen the damages of certain infectious diseases like Lyme disease and West Nile virus because they are transmitted to humans by insect vectors. So mosquitoes in the case of West Nile virus and ticks in the case of Lyme disease. So those vectors respond to changes in environmental conditions by oftentimes expanding their range, right? So we've seen, for example, a huge increase in incidence of Lyme disease in Michigan over the past 15 years. Part of that is a climate story. Part of it also is where people live. So I want to just step back and reiterate here that this is not a climate change attribution study, right? I'm not an attribution scientist. We didn't do the statistics to understand how much of these 2012 damages were attributable to climate change particularly. Rather, we're using these case studies as sort of emblematic of the order of magnitude of health damages that we're considering when we talk about climate change. So each of the impacts on this map are climate sensitive. They're expected to worsen to one degree or another in the future, either in frequency, intensity, duration, or geographic extent. The science is really solid on each of these impacts. We could have gone further on the emerging science of drought impacts, for example, but we really stuck to the impacts for which there is robust science documented in the National Climate Assessment and other places for adverse impacts. So I mentioned the challenge of sort of data gathering here. And this table from our paper, this was published in a journal called GeoHealth just in September. This table gives you an idea of what I spent a year and a half doing at NRDC, right? So stitching together more than 36 data sources from the peer-reviewed literature and data collected at the state level, oftentimes in public health departments, but also data from our federal agencies, right? This is the data that we are all, as taxpayers, funding our federal scientists to collect and disseminate. Right now, we don't have a coordinated federal effort to track climate change and health, right? And so that's why it was fairly complicated to assemble the evidence base here. We also know that public health science takes time. Any science takes time, right? So for Hurricane Sandy, for example, there was a study published just this summer on pregnancy complications linked to the storm. So that's 7 years after the storm hit, which really sort of signals the ongoing project of science in terms of understanding impacts, but also the need to focus our attention as a public on these profound damages, right? So oftentimes our media run from one climate-fueled disaster to the next, and we sort of leave the public behind in terms of understanding damage to mental health, for example, right? So if you lose your house in a storm or a fire, oftentimes you're suffering through profound anxiety and stress as a result, and we're not doing a good enough job of tracking those impacts and spelling out those impacts to policymakers and making the case for avoiding the overall problem. So in terms of estimating health costs, it's a sort of similar story in terms of trying to tell the overall picture. So we counted the number of deaths as well as illness triggered by these exposures. So we're talking about hospital admissions and emergency department visits. Oftentimes in public health, our monitoring of health problems really ends there. Did you go to the hospital or did you go to the ER? But we know that costs are falling on folks long after the initial sort of intake at the hospital, right? If you're having to be treated by a doctor for a number of days, you may be losing work wages during that time. And once you're hopefully eventually discharged from the hospital, you may require ongoing care in terms of outpatient care needs, home health care, and certainly prescription medications in many cases. So it was our attempt here to stitch together the data on the cost side too. The Centers for Disease Control and the Agency for Healthcare Research and Quality monitor health costs in this country. And so we used federal databases, the Healthcare Cost and Utilization Project, HCUP, as well as the Medical Expenditure Panel Survey, MEPS. Both of those databases are public, a little clunky to use, but they're public. And so they allow us to connect each specific health impact, asthma attack from allergenic pollen, for example, to these expected costs. So I mentioned sort of the broad range of environmental exposures and health impacts that we're talking about here. And I have sort of signaled towards the emerging evidence space here, but just wanted to spend a little bit of time on this point. We're talking about mental health impacts, which are very often excluded from our understanding of climate-sensitive exposures, but also other impacts like homelessness or interrupted dialysis care, right? So we need to think about the impacts not just in the days and weeks following a storm or a fire, but really in terms of months and years. We also took advantage of really fresh science out of the Environmental Protection Agency that sheds new light on the huge health risks of wildfire smoke. And so we were able to collaborate with federal scientists to understand local impacts from fires in 2012 in 2 states. So I mentioned a mix of sort of fear and hope. So this is sadly sort of the grim list of health problems that we looked at in our study. So this is each of the 10 case studies spelling out the specific health problems in terms of early deaths and illnesses tied to each exposure. And so I want to also acknowledge here that this is a limited range, right? So we looked at a couple dozen data sources, but there is definitely more suffering happening even in just these case studies. And so, when we're talking about climate change, we're not just talking about extreme heat, we're not just talking about an impact happening once, right? But we're really talking about cascading impacts. Wisconsin, where I'm from, certainly struggled with Lyme disease problems in 2012. Those weren't quantified here. We looked at Michigan. But I just want to tell the story a little bit in terms of each of these case studies and acknowledge that we're just scratching the surface in terms of quantifying damage. So, oops, sorry for that bottom line there. These are the overall health impact results from this study. So we estimated more than, you can't read it, 900 deaths from these 10 case studies, as well as more than 20,000 hospital admissions and almost 18,000 emergency room visits. Each of these was quantified using the publicly available data sets. And you know, I actually forgot to mention the harmful algal bloom case in Florida. Any of you from Florida? Okay. Maybe you can speak to the very real impacts that problem is having on recreation and tourism. The human health angle is sort of beginning to be told, but we wanted to really take advantage of a new peer-reviewed article and monitoring happening at the federal level to shed light on algal blooms. So this is 900 deaths, thousands of hospitalizations just from these case studies alone. But then the question becomes, how much is it costing, right? And so we use that combined valuation method using the value of a statistical life, which is a metric commonly deployed by the federal government to spell out the economic damages of early deaths triggered by pollution, as well as the cost of care, right? So we end up with basically a $10 billion price tag just from these 10 case studies alone. To give you some context on that number, the billion-dollar disaster list for 2012 estimated about $40 billion in damages across the country. So we're adding about 25% from just these case studies alone, right? So this tells us that health is profoundly, ignored in these federal assessments, and that it's got huge economic ramifications, right? So we need to be thinking about human suffering and human costs falling on Americans right now from these exposures. One question that comes up, and certainly came up in 2011 when our team published the first study, is who's actually paying that $1.6 billion in illness costs, right? And so we were actually able to estimate the expected payers here. What we found didn't surprise us, but it was still pretty sobering. About 2/3, about 64% of the illness costs fell on Medicare and Medicaid patients. Those are our most vulnerable neighbors across this country. It's the economically disadvantaged. It's the very young, very old, folks who are struggling to cope with very real health damages. That aligns with our public health science in terms of understanding who's most vulnerable to these events. Right now, more than half of all American adults report financial hardship related to medical care, and as a result, they are delaying or completely foregoing care because they can't afford it. We're having a huge healthcare debate in terms of the presidential primary, and one point I'd like to make is that the climate conversation is certainly increasing, but we need to connect the dots here, right? Our federal insurance systems, Medicare and Medicaid, face huge risks from climate change that haven't been largely acknowledged. So when we think about the future, and we think about our country, for example, signaling, pulling out of the Paris Accords, we need to connect the dots here in terms of huge risks for all of us as folks exposed to climate change, but all of us as taxpayers too, right? We don't want to go stupidly into this future of increasing greenhouse gas concentrations and tremendous health risks, right? We need to make choices that are cost beneficial and that can protect public health in this country and around the world. So we estimated $10 billion from these case studies alone, but we really have this challenge of telling the larger story, right? What's happening across the country. We need to connect these case studies to what we know from the science to be huge risk, right? Right now, we can't assemble a national portrait of climate damages because of inadequate surveillance, but we can start to tell the story in terms of the overall fabric here. So this is 2012, the year that we looked at for our case studies, and you'll see that each red dot on this map is a temperature record set. And so we know that there were huge risks happening in states that we didn't look at, right? And so one challenge of ours is to really sort of connect this specific study, this one piece of work, to the overall picture. So the last sort of figure in our paper is this comparison, right, of the state level impacts, which here are the blue bars, and the corresponding national burden for most of the impacts that we looked at. So all that yellow hashing is the percent of impacts that are happening outside of our case studies. So you can see that except for West Nile virus and hurricanes, we captured just a small percent of what we know was hitting Americans in 2012. And this really gives us grounding to say that the health damages ran into probably hundreds of billions of dollars in 2012 alone. So think of those costs happening year after year, accelerating and increasing in the future, right? I think this is another piece of evidence that tells us we need to act, and we need to act fast. So we came up with a number of specific policy recommendations, working with our advocates to understand what this actually means for our climate advocacy, right? So we know that this is another reason to cut carbon pollution because it's really fueling the underlying problem. But we also know that we need to better fund adaptation, right? Public health preparedness around this country is certainly not equipped to cope with the risks posed by climate change. And we also need to think about health when we're evaluating these adaptation actions, right? So when we start an early warning system for hurricanes, or we fund a cooling center, we can demonstrate real sort of cost-benefit advantages from those interventions, but we need to think about health from the beginning when we plan them. I've harped on the surveillance and tracking a little bit, but as a scientist, it really behooves us to connect the dots here and advocate for our federal agencies that are doing the data collection to work together, right? We can't continue with these silos of information that are hard to access, certainly for the public. But overall, we also just need better cost estimates, right? So the estimates like the social cost of carbon need to account for the current science, right? Right now, the social cost of carbon, does anyone work with that? You probably know more about it than I do. Okay. Right now, the social cost of carbon includes health to some extent, but certainly not to the extent to which our epidemiology has explained the problem, right? And so if we update that metric and encourage federal agencies to revisit that topic, we can actually capture even more sort of cost-benefit advantages from preventing increasing climate change. We also need to focus more on the illness burden related to climate, right? So deaths are relatively easier to count. The illness burden we know is huge, but due to the data limitations and sort of a lack of prioritization, they've been largely neglected from the peer-reviewed literature especially. So this is an area of focus that we need to shed some more light on. As someone working on climate and health and sort of trying to tell the story, I just wanted to illuminate the, I think, advantages of telling local stories. We often hear about climate change as a global problem, as a national problem, which it certainly is. But it's also a very local problem, right? People need to see themselves in this issue in order to act on it, right? And so a study like this really allows us to bring these impacts home, talk about pocketbook impacts in a way that we really haven't been able to do very well before. You might have seen a New York Times editorial in the last couple of days sort of blaming climate scientists for the predicament we're in, which is, I think, a interesting argument. But certainly as scientists, we can do a better job of communicating what our peer-reviewed literature actually says, right? And make these impacts real for people in a way that we haven't been able to do before. We're also curious to work with especially students and young folks to tell the story about climate change in new ways. I brought a bunch of fact sheets here that I'm happy to share. We want to connect with a youth movement that is really lighting a match in terms of focusing public attention on this issue in a way that I've never seen before. And so we're really facing the challenge of striking that balance of hope and fear, talking about a future that's pretty scary, but also talking about choices that we have right now. I also want to talk about equity a bit more. I mentioned the sort of who pays angle of this work, but I want to give folks a sense of sort of the global picture. This is another figure from Jonathan Patz. Again, it's more than a decade old, but I think it still rings true in terms of explaining the drivers and impacts of climate change. So this is a cartogram that basically scales each country in the world in proportion to its historical climate emissions, right? This is not the map that we're used to looking at or used to thinking about when we talk about the Paris Accord, for example. But this is the world as it is, right? We have historically been the largest emitter of greenhouse gas pollution, and that's something that's often lost in our sort of public day-to-day understanding of the risks and really who should be paying for solutions. But the inverse of this story is who's expected to pay for climate change in terms of health damages, right? So this is, again, another cartogram scaling each country's size according to vulnerability to climate damages. And so you can see it's basically the reverse of the previous map, right? The countries that are least responsible for the problem are going to pay the most in terms of suffering. And so when you hear discussion about sort of where each country falls right now in terms of carbon pollution, remember that there's a history here, right? There's a history in terms of a well-funded industry. There's a history in terms of decisions that have been made over decades to put us in this predicament and keep us in it, right? So don't lose sight of the overall picture here and the need for collective action, but certainly equitable choices when we think about shaping policy and capacity building and technology transfer, for example. I also just want to sort of draw attention to the larger picture and tell the adaptation story a bit more. I think I'm running out of time, so I will walk kind of quickly through this. I do quite a bit of work in India, one country that's expected to face significant climate risks. The city of Ahmedabad in western India, in Gujarat, suffered through one of these impacts fairly recently, a heat wave in 2010 that killed 1,300 more people than an average summer in this city. And we've been working in this city for about a decade to try to better equip this city and others like it with tools to cope, to adapt to a warmer world. One project we've been focusing our attention on are these heat action plans, which are basically comprehensive local efforts that take advantage of new heat forecasts available through the Indian government to actually act on the problem and prevent suffering, right? So we're trying to implement risk communication, take advantage of newly available forecasting capacity through the government, as well as building capacity in the medical sector and really establishing cooling centers and the types of things that you see in other parts around the world. These heat action plans have since scaled up from Ahmedabad, which was the first in South Asia, to more than 100 cities in India right now. So this is definitely a work in progress in terms of tailoring each city's programs to local needs. But there are success stories here that we can learn from in the United States. Oftentimes the narrative is that we're going to transfer our knowledge from wealthy countries to poorer ones. But the narrative here is really the opposite. We have a lot to learn from folks experiencing climate risks right now. As an epidemiologist, I'm excited to see evidence showing that these plans are effective. This was a study published in 2018 evaluating basically the heat action plan impacts in India, and it's estimated based on the data that we have available that such a plan basically helps us to avoid more than 1,000 heat-related deaths each year as implemented. So we can really spell out these benefits for policymakers if we're careful about sort of shaping the programs and monitoring health from the beginning. Got a few more minutes left, so I'm going to close with hopefully a bit of optimism. This is a picture of the New York skyline in 1966. And I think for a lot of us who weren't alive at that point, it can be lost on us the amount of progress that we've made in this country in terms of cleaning up our air and lengthening our lives, right? The Clean Air Act has resulted in average life expectancy increase of about 2 years for the average American. But for folks who didn't live through this pollution and who were lucky enough not to, it can be lost on us sort of the success stories that we've already achieved, right? And so this story of the Clean Air Act really gives me some hope in a pretty worrying time that we can actually come together and address a problem that is harder to see, but certainly just as damaging, if not more. The Environmental Protection Agency estimates that the health benefits achieved by the Clean Air Act outnumber the compliance costs by huge margins, by more than 30 to 1. So it's estimated that the investments needed to clean up America's air have cost about $65 billion, but the benefits to all of us exceed $2 trillion, right? So this is hugely beneficial, but it's a story that's not been told in terms of collective action and federal regulation actually working to protect us, right, like it's supposed to. I used to work at EPA. It is a public health agency as well as an agency working on environmental protection. So remember to connect the dots here when you hear others trying to isolate the story and critique these efforts, right? Right now, the United States isn't immune from air pollution though, right? So it's a good story, but it's one where the fight needs to continue. We know that a lot of Americans, especially those who live in California, are living in areas that exceed the national ambient air quality standards, the safeguards that protect us all from dirty air. If you add it up across the country, it's millions of people, right? It's more than 120 million for ozone. It's about 20 million for fine particulates. We know that that pollution is damaging to human health, killing about 100,000 a year. And so that's relative to the current standards, right? EPA right now is revisiting the air quality standards and taking advantage of the new science that's emerged since the last review. There's an open comment period open now that allows all of us to weigh in and urge EPA to do what the law requires, right? Use the best available science to shape those standards. We know that there are bad health effects below the current safeguards, and so we need really a strengthening federally of those limits. I'm almost out of time, so I want to just sort of walk through some maps and end on a note. Sorry, I had all this cool stuff, but I ran out of time. I want to talk about sort of the win-wins here, right? So just like the air quality story tells us, if we transition our world towards the clean energy system that we know we need, right, that the science is really strong on, we can achieve a number of wins. And these wins can be pretty immediate in terms of reduced air pollution, in terms of improved public health, in terms of avoided billions of dollars in healthcare costs, and also addressing the threat of climate change, right? This co-benefits framework has been around for a while, but it's not broadly appreciated beyond the sector in which I work. And so we can really spell out very real gains for this country in terms of economic benefits from acting now. There's so many reasons to act, and I hope that some of this evidence will be persuasive to you all in continuing the fight. It's a long fight, but we know we have to continue our ambition on it. And then lastly, I want to just invite you to check out a tool of ours that helps to sort of tell the local story of climate change where people actually live. This is our Climate and Health Maps portal. You see the URL there, which basically brings some of the federal science to life in terms of allowing folks to zoom in to the places where they actually live to understand how extreme heat, for example, is affecting their locality. We've done this for a number of impacts. You can see on the left side, infectious disease, air pollution, et cetera, et cetera. These static maps that live in reports are only so useful, right? And so we know that we've got to develop dynamic tools, take advantage of new technology to tell this story in new ways. And curious for anyone's thoughts on ways to tell that story even further. And so we have a kind of growing program on connecting the dots between climate and health here, and we're always eager for input on whether these things are useful or whether there's tweaks that could be made to make them even more effective. I think I've hit 1 o'clock, so I just want to leave you with my contact info and offer myself as a resource on this topic. And I think some folks may need to head to class as we get into Q&A. Thank you. Oh, yeah, sure. And see, yeah.
So from the case studies where it was $10 billion, did you decompose it all into what was the additional lost wages versus some sort of unseen healthcare impacts that we don't usually think about?
Yeah. So the question was, did we sort of like disaggregate that price tag into lost wages, direct care, et cetera, et cetera? Yeah, we did. I can point you to, I can actually just share the paper with you. But yeah, we You know, we estimated lost wages just using basically the Bureau of Labor Statistics average wage. So we know it's, you know, a pretty coarse tool to estimate those damages, but it's a start. Happy to share that with you. Yeah?
There's a current effort the last several years of the EPA administration, the political folks, to discount the health costs. For example, the cumulative or the co-benefits.
Right.
Health benefits below the national enterprise standards, health benefits outside the United States. What's the NRDC doing with respect to that problem?
Good question. Okay, so yeah, this co-benefits framework that I sort of showed has been directly attacked by, sorry. Oh, yeah, sure. So the question was about this co-benefits framework and the current federal attack on that approach to quantifying benefits, really. So there has been an effort within EPA's political leadership to basically isolate those four circles that I talked about just to sort of the direct impacts of regulations. So it's akin to, you know, if you stop smoking, your health improves in really, you know, probably dozens of ways. But the federal approach would say we're actually going to just pay attention to one specific health problem that was reduced from that, you know, smoking cessation. So it's basically an attempt to diminish the benefits and inflate the costs, right? And so that would help to basically slow the transition to renewable energy. NRDC is working on a number of fronts to, you know, illuminate the co-benefits framework that's been the approach federally for years. I'm involved in helping to support our legal team in making the case that you know, co-benefits that accrue beyond the target pollutant. So for example, a mercury rule that also achieves benefits for ozone and particulate matter is, you know, we need to spell out the evidence base here in a way that our political leadership at this moment would like to ignore. The best available scientific evidence tells us there is no safe level of PM2.5 fine particle pollution, right? And so bringing that epidemiology to bear is really, you know, our challenge right now, and sort of holding back continuing attacks on the co-benefits framework. We're also right now working on the air quality standards reviews, which are sort of hidden from public view, but there has been a coordinated assault to sideline people like me, science, from this process, right? The science that's emerging tells us there's really no safe level probably of any air pollution, right? Which makes sense. But right now, we have a federal air quality standard of ozone that's maybe double the level it actually should be in terms of health impacts that are showing up in Americans in, you know, really huge studies of millions of people, right? So it's a challenge right now to keep up with a coordinated federal anti-science effort that is really jamming up the system. I've got, you know, 4 overlapping comment periods to deal with in the next 2 months, and so we're really, you know, trying to stay on top of all of these things. But I can definitely say it's been a challenge. Go ahead, and then you.
Looking at the current situation in India, you know, the way the air pollution right now, and the media issue, the exposure, and the health situation is deteriorating in terms of, you know, the children and everything else. So what do you think the immediate strategy that India should adopt in trying to really reduce this pollution?
Yeah, so the air pollution in India, the situation has made headlines certainly in the last, you know, couple of weeks, and it seems that, you know, every year around this time we see the media focus on the issue and then immediately retreat once things marginally improve. So part of the challenge here, I think, is to connect these huge exposures, sometimes more than 1,000 micrograms per meter cubed, right? So we're talking about, you know, orders of magnitude above WHO, World Health Organization recommended limits. Part of the challenge is to tell the overall story of more than 1 million Indians dying every year from air pollution-related disease, right? So it's not just a 2-week post-Diwali problem. It's a problem related to thermal power plants. It's a problem related to enforcement, right? In terms of air pollution limits that are written on paper but not necessarily taken and enforced by state pollution control boards. It's also a health problem, right? It's a communication problem. We've seen survey data out of India demonstrating that far fewer than one might expect really connect the dots between even short-term exposure to air pollution and very real health risks in terms of asthma, heart disease, et cetera. So we've certainly got our work cut out for us. We work specifically a lot on health risk communication and bolstering enforcement and compliance because, you know, it's sort of a legal shop with a lot of history on that front. That's been one of our strengths, but we know that we need to work with, you know, really tens or hundreds of partners to make this actually, you know, change. I think, did you have, you good? Okay, yeah. Go ahead.
Given your stated mission and the programs that you currently have in effect, can you identify what you would think of was a major result that you had some cause in affecting that made a difference? And what might be your next 2 or 3 or 4 practical wins that you'd be trying to attain that, you know, would make a difference?
Yeah, you know, we as NRDC, I think, are largely known, to the extent that we're known, as a legal shop, right? As folks defending environmental protections. And so certainly we have been the ones, I think the statistic is that we've sued the Trump administration, largely EPA and the Department of Interior, on average every other week for the past, you know, 2.5 years, right? And so our win record on that is pretty strong, I believe. I'll have to pull up the numbers, but it's, you know, I want to say 4 to 1-ish. And so, you know, I think when we think about the current predicament that we're in, it's certainly a challenge of pushing back against unprecedented attacks on science, on our national monuments, on our national parks, on clean drinking water, on clean air protections. We really have our work cut out for us in terms of a multi-front assault on public health protections. And so, you know, I can definitely share with you some more detail on those cases, whether it's, you know, drinking water in Newark or it's monument protections out west. We've been, you know, enormously successful in dismantling a pretty sloppy effort that's happening at the federal level. You know, from where I sit and working on EPA actions and the Clean Air Act, we have seen an attempt that was largely out of public sight to disallow EPA from basically using peer-reviewed science in setting the air quality standards. Because I'm a health scientist, right? A lot of the data that we work with is protected by HIPAA. It's data that allows us to identify health problems down to the individual level. And so justifiably, you know, Congress decided that that sort of data should not be made publicly available in terms of identifying someone who has lung cancer, right? And so EPA has, you know, contorted itself to pitch this issue as a science transparency one rather than one funded by vested interests, especially in fossil fuel industry, to inflate the costs of regulation and decrease benefits. So we're trying to, you know, force the agency to do what the law requires, which is use the best available science. Yeah.
Following up on this, what's your sense of how difficult and how much time it will take to repair this environmental protection?
How much time will it take to repair? I think there are, it's a hard question to answer. You know, I think, for example, with the air quality standards, those decisions right now for ozone and fine particles they're attempting to push through rules by December 2020, which is not lost on anyone in terms of a deadline that would avoid accountability and trying to really jam things through before potentially a new president takes office, right? And so the point that we make is that right now millions of Americans are breathing polluted air. Many more are breathing air that we know is damaging, but the EPA protections really don't speak to. And so, you know, we know that this is a fight that will continue for years and years ahead, but we know that one of the most urgent things we can do is act on climate because it's a non-linear problem, right? Every increment of degree delivers disproportionate harm to this country and certainly global populations. There was a question that came up about domestic and global impacts. You know, the the Trump EPA attempted to diminish this social cost of carbon understanding of domestic impacts to $1 per ton of carbon pollution. A study like ours and many others like it point out that, you know, even if you just isolate damages to the United States, we know that it's many, many more dollars per ton of carbon pollution. And so we're hoping to, you know, connect that science to unprecedented attacks in the legal arena. Yeah.
I'm interested in the need for a carbon tax. You didn't specifically mention that. And I think that economists, frankly, and I'm one of them, have done a terrible job of getting the world to understand that that tax is a necessary way to filter all the way through the system. And we saw that when Macron tried to put in a tax in France, that it brought out the yellow jackets.
Right.
I think that the world, just in terms of the things you worry about, I worry about that we've just done a terrible job of selling it. Do you guys work with that issue at all?
We do. I will say that we're doing a lot of active work right now in sort of figuring out the just transition issues and figuring out the distributional impacts of a carbon tax or such a tool. I agree with you that that is, you know, probably the quickest, most efficient, you're the economist, way of achieving, you know, change that really spells out these damages in a way and puts a price on the suffering, right? We know that we're effectively paying this tax right now, right? It's regressive, it's random, it's rising, right? And so we really need to name that and call attention to the continuing costs of delay and inaction. We've got a well-funded you know, industry that is very quick to point to the costs of the Green New Deal, for example, right? Which ignores all of the suffering, right? And that's because we've got an equity issue, right? We have a project of telling the human story that's been largely neglected and certainly underfunded. And so, yeah, I agree with you that that's, you know, sort of probably, you know, one avenue in which to tell this story, and certainly folks at NRDC are working on that. Yeah. Right.
Would something like that be feasible in the United States? It kind of seems like common sense, but it doesn't exist here.
I'll leave it to, I think there's people, I'm definitely not the one to answer that, I think. I'm sure we've got folks in this room who can weigh in on that. Maybe afterwards. Okay, you and then you.
Thank you for this presentation. I'm new to US politics.
Okay.
I'm still figuring out things.
Welcome. God, sorry.
My question is this, when you talked about, when you were listing down the results, you talked about impacts on the elderly,
Yeah.
older adults,
Yep.
and the marginalized population. So, just in that context, do you see are there specific gender and ethnic variations that you find in terms of helping tackle climate change? And if so, then what are the policy recommendations that NRDC is probably suggesting for better negotiation with the state for these communities?
Yeah, so the equity question in terms of gender impacts you mentioned and people of color, is that? Ethnic variation, okay, yes. So this is an increasing focus of the environmental health community in terms of spelling out gendered risks related to climate. You can imagine that folks who are caretakers, oftentimes women who have to respond to emergency evacuations, for example, are charged with not just protecting their own health, but that of children, right? And so we know that there are unique stresses placed upon those populations. And so we're definitely exploring that avenue and doing increasing work, I would say, on that area. In terms of other risks, you know, my father's from India. There's well-established epidemiology that South Asians actually are at increased risk of cardiovascular problems from air pollution, right? There is genetic risk conferred on specific populations around the world that's not well illuminated. And it explains why we see sometimes huge disparities within a particular cause of disease. And so we are, you know, trying to tell that, that story, but also illuminate, you know, we know what the answer here is on climate, right? We've got mountains of scientific evidence. We haven't been all that great about communicating it, but I think as we continue those lines of inquiry, it's incumbent upon us to really point to the underlying problem and really focus a lot of energy there, and also continue to explain this story in terms that will resonate with people. And I'll chat with you more after about recommendations and what we're up to. Yeah.
Are there also benefits to human health with climate change? I mean, we know mortality rates are much higher in winter, for example. Should that also be considered in analysis?
That has, yeah. So that question comes up sometimes in terms of a warmer planet and folks at reduced risk of cold-related deaths, for example. In certain parts of the world, cold-related deaths will decline, but certainly the risk that we face in terms of a world that's 3 or 4 degrees warmer, oftentimes we're limited as public health scientists to speak to the true range of risk. So I work with dose response functions for temperature exposures that are within that pretty confined envelope, right? And so oftentimes that leads to conservative estimates of the ways in which higher temperatures exacerbate underlying medical conditions that we know that millions of people struggle with. And so oftentimes when you see assessments that point out sort of a balancing of effects here, that may be for one effect, but we're talking about really, I showed 50 health impacts related to climate, right? And so there's been no convincing evidence for me that points to a net gain for human health from climate change.
Well, we know that global life expectancy has been also increasing in this whole warming period too.
Certainly, fossil fuels have delivered gains in terms of life expectancy, but if your home is underwater, right?
I'm talking as a broad.
Well, I'm talking about, individuals who have no existence, right?
Well, sure, but for every person who suffers flooding, there are many people that enjoy longer lives.
Well, we're talking about, I don't know if you saw the analysis out of Yale, I think last week, showing risks for sea level, inundation of communities that were way beyond estimates that even, the scientists sort of recognize. So, I think, fossil fuels have delivered benefits. I'm not saying that they haven't. But, life expectancy is one metric, and there's all sorts of impacts that the science is really catching up on in terms of explaining the overall situation.
Great, thank you.